Hello, everyone. Welcome. My name is Jennifer Williams. I am your host today for a discussion about kids and asthma. There are a lot of questions out there surrounding children and asthma, and we are here to answer all those questions for you and debunk a few myths that are out there. We are so honored to have with us Dr. Al-Turki, pediatric pulmonologist, a member of the RWJBarnabas Health Medical Group. Any questions you have for Dr. Al-Turki, drop us a comment below. We will answer them as we get them. And help me welcome Dr. Al-Turki. Thank you so much for being here today.
Thank you so much, Jen. Thanks for your time, and I'm really happy to be on Facebook Live and answer questions from families and anybody who has a question for me.
We're so lucky to have you today, and thank you for taking the time out. And why don't we start with you just telling us a little bit about yourself?
So my name, as you mentioned, my name is Al-Turki. I'm one of the pediatric pulmonologists at Barnabas Medical Center. I specialize in pediatric, and I did extra training in pediatric pulmonology. So I see all kinds of kids with pulmonary or respiratory lung disease, ranging from cough, asthma, cystic fibrosis, and so on and so forth. But today we'll be focusing on asthma, and again, I'm happy to answer any question.
All right, well, let's get right in. So what are the signs and symptoms parents should look out for in identifying if their child does have asthma?
Very good question. And actually, this is, I would say, maybe the most common question I get asked from patients in the office, from family and friends, and from people. Like when people ask me, what do you do for a living? And I tell them, I'm a pediatric pulmonologist. This is one, of the common questions I get asked. So the most common signs and symptoms, cough, I would say, is probably persistent cough. Usually it's during the day, but sometimes it's even worse at bedtime. Recurrent wheezing, recurrent shortness of breath. Sometimes kids will complain about chest pain and labored breathing. So these are the most common signs and symptoms of asthma.
And if we are identifying these signs and symptoms, what should we do?
So the first step would be, seeking a medical attention. And I would say the first and the most appropriate step is going and seeing the primary care provider, because they will do the initial investigation. They'll probably give some treatments or some medicines. And after that, if the primary care provider feels like, they're not able to manage asthma, or they manage the symptoms, then they would refer them to me, which I will be taking over, and I will be managing these symptoms and helping the child basically go back to their normal daily activity.
And just so everyone knows, Dr. Al-Turki's office is in West Orange, and we will put all those details below in the comments for you, just so you have that information. So so we've identified that we have, my child has asthma. How do we manage asthma in kids?
Very good question. So managing asthma, there is like different ways and different approaches. Our approach here at Barnabas Medical Center, we have a multidisciplinary team. So includes doctors, nurses, social workers, respiratory therapists, asthma educators, and together we come as a team, and we approach this disease or this illness and try to manage it appropriately. I would say managing asthma divides into two ways or two approaches. First thing, avoiding triggers, and that includes education and teaching and knowing what triggers the symptoms of asthma. The second approach or second way is basically giving medicines, including inhalers and maybe a little bit of liquids, like including steroids and stuff like that, and, basically helping the child understand their symptoms and know when they should be taking the inhaler or should basically going to the emergency room or seeking medical attention.
So it's important. Know your body and know, what those triggers are and what they can be. Could we talk about some of those triggers? What are some things that do trigger asthma?
Very good. So this is a cornerstone in asthma. So as you mentioned, it's important to know your body and your triggers, because if you know your triggers, you can avoid them. And second thing, also, if you're exposed, then you know what's going to happen next. Basically, you'll have the symptoms, you'll have shortness of breath, so you are prepared. So if you're prepared, you can always have the minimum effect on your lung. So triggers include, we are in the spring season now, so allergens are very, very big trigger, like, pollen, trees, grass, all those things. Also, some people who have like sensitization or they have allergies, like, maybe pets, like, cats, dogs, or if they have like, fungus in the house, like mold, sometimes can be a trigger. Smoke exposure, it's a big, big trigger also. And I always advise my patients, the family, the parents to avoid smoking as much as they can. Another trigger in younger kids and in toddlers and in preschoolers is a common cold. So the kids will have a little bit of cough and runny nose. They get a little virus or a little cold, and subsequently they will have asthma attack. These, in older kids also, and as I mentioned, the parents, they should avoid smoking, but older, like teenagers and stuff like that, smoking is a negative thing, and we know it has a long-term side effect on the lung, and it also has a bad effect on kids with asthma. And smoking, it's not only cigarette, but it's also vaping, e-cigarette, hookah, all type of smoking is always has negative outcome on asthma and lung overall.
So all things to avoid if you are suffering from asthma. So if a child does have asthma, can they safely play sports and do other physical activities?
Good. I'm glad you asked that question, because parents come to my office and they're concerned, which I understand, because they want their kids to play sports and be active. And the answer is actually they can play sports, and I do encourage them to play sport. They just need to be a little bit cautious, and they need to have their medicine with them, their inhaler with them. In case they have like shortness of breath on the field, or they have like difficulty breathing, they just need to be prepared. And there is a lot of research has been done, and it's been shown that overall sports and exercise is good for the heart and the lung. Even if you have asthma, actually it's a good thing to participate in sports. So I do encourage even kids with asthma to play sports regularly.
And what about exercise too? Can regular exercise help manage asthma, or?
So regular exercise by itself will not manage asthma. Managing asthma will be like, with medications and with a multidisciplinary approach. But exercise overall makes your lung healthier, and the healthier the lung, the less symptoms or less signs and symptoms of asthma the child will be having. So it's a good thing. It's not enough, but it's a good thing for the child to be doing.
So all safe things, again, just as long as we're aware of, we're prepared and we know. Back to our triggers again. Are there long-term effects of having asthma?
Not a lot of long-term effect. Actually, most kids, I would say maybe 80% of the kids, up to maybe 90%, they outgrow asthma by the time they're like 14 or 15. So most kids, they will be fine and they will outgrow it. Some kids, unfortunately, they will still have persistent asthma, But there is no major long-term, if it's managed well and appropriately, there is no major long-term effect from asthma.
And I know that we spoke a little bit about the multidisciplinary approach at the Pediatric Specialty Center, but how do we treat asthma, and what is the approach of your team?
So the approach of our team starts basically with getting to know the child, getting to know the parents, and basically knowing of what the triggers are. And the cornerstone or the major thing is education, because again, if you know what the triggers are, like what the symptoms are, some actually kids or some patients, they have poor perception of their asthma. Like they will have shortness of breath or they have symptoms, but it's hard for them to understand or even verbalize, so their lung will be kind of compromised, but they are not verbalizing it to the family, or they're not talking to their parents. So, so they're not getting the medical attention they need. So education, and we work on that really hard. So it's myself and, the nurses, the respiratory therapist, all of us, we sit with the family, we explain to them what happens next and what's causing their symptoms and how they deal with it. And for most time, the kid will be basically having healthy life and will be able again to just have normal daily activity and normal basically life.
And so know your body.
Exactly.
Yeah.
Yes.
Okay, let's get into it. What are some of the biggest myths that you hear when people come into your office and you're like, well, I've heard this about asthma and I've heard about that?
Oh, that's good because I hear all these myths from parents when they come to the office, and at this time I'm glad you asked this, so it's time to debunk some of the myths. So as we mentioned before, it's like if asthma is a lifelong disease, and it's something you cannot get rid of, and the answer actually, or the right answer is it can be lifelong disease, but again, for most part, kids outgrow it and they do really well. The other thing people think also, like ask me all the time, is all these inhalers or asthma medicine, they're addictive and the child needs to be on them lifelong. And the answer is not. They just need to be there on them, even if they're on them for, let's say, prolonged period of time. They eventually will come off these inhaler, and they will not need any medicine, and they'll be living their life completely normal. Some of the questions or the myths that I hear from parents are like, should my child stay home? Like, don't go out to like the restaurants, to go out to, play with friends. Or should my child just stay, or like, don't play sports or don't exercise? And the answer is no. And what actually one of the goals that myself and my team work on is to make sure the child basically has a normal activity. So like normal daily activity. So he lives normal life. He goes to school, he goes to the restaurants, he goes to friend's house, and do all the things that they like to do.
We circle back to knowing yourself, knowing your body, knowing your child. I think that's a perfect spot to end. Is there anything else that we should be aware of or look out for? Anything else you want to tell us?
Nothing much, just basically the symptoms we talked about, trying to seek medical attention as soon as you can if you're concerned about one of those symptoms, and this is it basically.
It's manageable, right? Manageable.
It is very manageable.
Yeah. So thank you so much for joining us. And just so everyone has the information, so Dr. Al-Turki's offices are at 375 Mount Pleasant Ave in West Orange. And if you want to make an appointment, it's 973-322-6900. So it's child-friendly offices right in West Orange. And, you know, like he said, there's that multidisciplinary team there to help you out and help manage anything that comes along with your asthma. So thank you again for being here today and taking time out of your schedule.
Thank you, Jen. Thank you so much. It's my
Have a
pleasure.
wonderful, wonderful day.
You too.
Bye-bye.